everyone to our Global Wellness Day, 12 hours of transformation online celebrations presented by Chiva-Som and Zulal Wellness Resort by Chiva-Som. And nice seeing you all again for some guests who participated in our previous classes and workshops. Thank you very much. This seminar is entitled Wellness for Women. I am Kelvin Sukum Chittanon, Head of Communications at Chiva-Som, and I am your host today. This session we will be led by Dr. Rubia Shariff. She is a health and wellness advisor at Zulal Wellness Resort. And today, she will discuss wellness for women. Dr. Rubia is a naturopathic practitioner by profession with a passion for wellness and healing. She holds a bachelor's degree of health sciences in naturopathy, a postgraduate in psychology, counseling, and family wellness. And she is also a certified in clinical hijama cupping therapy. She is an experienced clinical naturopath, having practices in India and the Middle East. And now it's time to meet Dr. Rubia. Hello, Dr. Rubia.
Hello. Good afternoon. Thank you for joining us today. I'm Dr. Rubia Shariff. Today, we'll be looking at wellness for women, and I'll be sharing some valuable information on the same. So let's get started. In today's presentation, we'll be looking at some of the common complaints that we as women experience through puberty, preconception and pregnancy, right through the menopause. I am looking forward to further discussions, so you can pop your questions in the chat room and I'll be happy to discuss with them. So ladies, let's get started. Puberty is a major transition to womanhood. To mark this transition, there are traditions around the world celebrating this. Like in Hindu culture, it's celebrated with ceremonies and showers like rose petal, turmeric baths, or sandalwood baths. And the woman is gifted with gifting ceremonies. And in Arab culture, it's celebrated with pampering the woman and showering her with gifts. However, the physical reality is different. Some of the common conditions that will also be a part of this journey are like PMS, which is Premenstrual Syndrome, or dysmenorrhea, painful menses, or frequent acne breakouts, or just mood fluctuations. Let's look at what PMS is, or Premenstrual Syndrome. During PMS, women often gain up to 2 to 4 kilos of weight. And this is due to the water retention happening because of the estrogen in the body. And this water retention often occurs in areas, concentrated areas like breast tissues or in the hip region, causing bloating, sore and painful breasts, heavier on the chest. Women often change their bra because it normally doesn't fit, or women go a cup size heavier. And because of this heavy and tenderness, women cannot even do their regular day-to-day activities like swimming, running, jogging. It gets difficult for women to do their daily activities because of the sore and painfulness in the breasts. It also comes with abdominal cramps at different levels of intensity. Women experience these cramps because of the uterine line that's shedding during this period. Women also experience bloating as a common side effect of the water retention in the body. Mood fluctuations is a common complaint. Not just women complain about it, but the family members and the relatives or the partners complain that you're PMSing and you're just being too rude or irritable or any such mood fluctuations, which normally is not your likelihood to be. And women often have estrogen-related headaches or migraine. And let me explain to you why this is happening. This is because the free estrogen that's in your body and that's not being binded towards a certain activators. And these estrogen headaches or migraines often come at the stage of the ovulation period. So you often experience headaches or migraines when you're ovulating, And women also experience extreme fatigue or lethargy. All these symptoms often lead to women resorting to pharmaceutical non-steroidal anti-inflammatory drugs like paracetamol or ibuprofen, which are not sustainable in long-term usage. I would like to share some of the natural, more viable options for you to try at home and which are sustainable for long-term usage, which have no or minimum side effects. My first suggestion will be magnesium. Magnesium is an excellent muscle relaxant. It not just relaxes your muscles, but it also supports your nervous system. If you're feeling anxious or if you are just feeling overwhelmed, it's a great relaxant. Magnesium comes in different forms. You can either consume it by powder form or capsule form. My second suggestion will be Vitex Agnes, which is a beautiful herb and works excellent for women with irregular cycles or extreme imbalance in hormones. This also have to bear in mind that it's not as effective if you are on oral contraceptive pills. It also takes 3 months to set your cycles to a regular tone. Vitex is a herb that will regulate your progesterone and estrogen levels, so you have a steady flow of hormones throughout your cycles, not leading to all these symptoms that should be well maintained with this balance of hormones that you achieve through Vitex. We will be also looking at Clarissage, which is an amazing smelling aromatic oil that is known to regulate the uterine contraction and spasms. You can use it in your burner or a diffuser, or you can just dip into the bath with few drops of Clarissage oil in it. And it helps you regulate your uterine contractions. And the women who are experiencing abdominal pain will find ease with Clarissage. You can the application mode can be either applying over a drop or two over a pubic area, or just use it in a diffuser, whichever suits you the best. My other favorite option will be evening primrose oil. This is an excellent remedy if you're experiencing sore, tender, and painful breasts. You can use this oil to massage your breasts and it will help you release the tenderness. I also would like to suggest ashwagandha, which is also known as by the name Bethania, and it is known to regulate your cortisol levels. Cortisol is associated with stress, and women are stressed during PMS. So this also helps you to adapt with the stress, and it's a great adaptogenic herb. You can try consuming this every day in the morning, one capsule a day. I would also suggest if you can pair the ashwagandha with B vitamins if you are experiencing extreme amount of lethargy, tiredness, or fatigue. It also makes sense why we need to consume B vitamins as we are losing a lot of blood as the endometrium is shedding. And with the blood, we lose a lot of nutrients and important beneficial systems that were there in your system. So B vitamin helps you to refuel your energy and feel energetic through the day. So a pill of ashwagandha and a B vitamin in the morning will help you have a steady energy flow throughout the day, and it also boost your mood and your stress levels. And if you're still not convinced to take herbs and vitamins at home, there are more DIY options that you can also try, like hot water baths or hot water bottles to release the pain and spasms. Or you can also try limiting caffeine during your menstruation, as it is also known to produce more overwhelming effects. I would also suggest to reduce your sugar intake, as sugar is known to cause inflammation in your system, which leads to exacerbation of these symptoms. Coming to the next important phase, where we are now preparing the women to conceive and preparing for pregnancy, preparing your body for conception. And in this phase, whether you want to conceive naturally or if you are on a program of IVF, IUI, or any supportive therapy, this formula will suit all these requirements. And for a preconception formula, we are looking at preparing a good uterus, a healthy looking uterus, and beautiful eggs, and also supporting the thyroid function and boosting up your antioxidants in the blood system. To, to achieve all this, I would be suggesting some of these supplements like zinc, which is known to support the hormones, as zinc is a primary cofactor for most of the hormones that are used in the production of these reproductive hormones. It's essential to be using zinc as your supportive therapy. I will also suggest CoQ10. As I already said, we want to have beautiful eggs. We also are looking at good quality sperms with good sperm integrity and motility. So CoQ10 is excellent for good quality eggs and sperms. I would also suggest that my preconception formula can also be used for the men out there who are planning for the same, and it also does the same effect as to the women. So we will have good quality eggs as well as good quality sperms for a good conception. Let's look at selenium. Selenium is excellent mineral that supports the thyroid. As you know, thyroid is a hormone producing gland that produces the reproductive hormones. So it will be an excellent support system for the thyroid to use the selenium herb. I would also top up with omega-3, which supports the neural development and the brain development, as well as eye health in young developing embryo. Omega-3 is also known as DHA, and it also serves as the fatty reserves in your body. We have now been lucky and fortunate enough to have fallen pregnant. So let's look at our pregnancy formula, which is slightly different to our preconception formula. And also be aware of you checking with your GP before you try these supplements at home if you are planning for conception. Some of my top favorite recommendations for pregnancy are folic acid. Folic acid is known to decrease the neural defects in, in, in embryos and early developmental stages, while iodine is an excellent mineral that supports the thyroid function of the mother. And as a mother, women often the thyroid function is often 50% working extra in a pregnant woman than in the normal rate. So thyroid is a great way to support the thyroids to produce enough hormones in your system when you're pregnant. I also recommend iron as it focuses on healthy fetal brain development. Finally, fish oil, which is also known as omega-3 or DHA, is excellent with your brain health and eye health, both for the mother and the child. I would also like to take an opportunity to highlight that as women in their pregnancy or post-delivery are primarily focusing on losing weight as quick as possible, I would take this opportunity to remind you women to take it gradually, as it also affects the milk quality. I would suggest to give 12 months of time for your body to relax and recuperate after the lost nutrients from the pregnancy, and then take it forward. So take it slow. Let your body recover from the losses, and then plan on losing weight, not just immediately jumping into the weight loss programs. So we have got the babies all grown up, and now we are looking at perimenopause phase, which is slightly more stressful phase in women. And perimenopause phase happens at the age of around 45 years to 50 years. This is an excellent sign for us that your body is going into menopause phase. The body is naturally trying to show you some signs and symptoms and cues that you are about to go in menopause. And when you're about to hit menopause, it's always better to be well prepared so we don't have the symptoms that women commonly experience during menopause. Some of the symptoms or some of the signs or cues that your body is giving during perimenopause phase are like irregular cycles, or even spotting mid-cycles, or flushing or crankiness can be some of the early signs that you will see during perimenopause phase. And this will be an excellent opportunity for you to start preparing for your menopause. for me to start preparing the women in perimenopause phase, I would start with topping up their microbiome. As as topping up with microbiome, I would like to choose a wide range and large variants of microbiota to top up your system so that you have enough of it supporting your pH levels in your vagina and in your uterine health. So you are not experiencing all these symptoms when you're in menopause. So the preparation begins in premenopause phase, as well as it's an excellent opportunity for you to start cleaning up your diet, increasing the physical activity, and also enhancing your well-being levels during this phase. And if you have finally hit the menopause phase, which is also a stressful phase, I would suggest some of the symptoms that are commonly seen are irritability, forgetfulness, stress and anxiety, or palpitations or dry vagina. Like I said, that's the reason why we are topping up your microbiome in the pre stage. Is excellent for us to focus on these, as well as our night symptoms include sleeplessness, fatigue, rolling and tossing and turning. Also, milk thistle. It is also known as an excellent liver detoxifier. And what it does is you have a lot of free estrogen dominance happening in your body. So the free estrogen is revolving around your body and it has nothing to bind. So milk thistle helps your liver to detoxify this estrogen and release it through the excretory organs. The same effect can also be achieved by enhancing the fiber-rich diet. The fiber-rich diet also does similar to the milk thistle, where it binds the free-roaming estrogen in your bloodstream and expels it out, causing you to have a calm and a nice state. Finally, I would like to summarize something which is really close to my heart, and as we women would like to remind each other of what the modern era has been into, like having unnecessary, unrealistic societal pressure. We women try to fit into these unrealistic standards that the society has set us to look a certain way, and no normal women bodies are being accepted the way it is. I suggest as we women, we accept the woman body the way it is. A healthier body is more beautiful than setting into some standard or some figure which is unrealistic, and women often ignore their requirements, their bodily requirements to match this standard. And a lot of food groups are rejected or kept offside to achieve these standards, which often leads to deprivation at different levels of well-being. This deprivation leads to problems like anorexia, bulimia, dysmenorrhea, substance abuse, depression and anxiety, fertility issues, stress related problems, and STDs. It's often a outcome of ignoring all these nutrients that our body requires, and we are starving our bodies to fit into a standard, or if we are following some sort of diet programs. So it's a gentle reminder for you ladies to empower yourself to accept the way you look and the way the woman should look, a healthy woman's body. And I would thank you, and I'm open to discussions.
Thank you, Dr. Rubia, for your interesting workshop. Very concise presentation, but I am sure that everyone have enjoyed the session and have learned some useful tips for today that they can also practice at their own home. Here are some questions in the chat. Some of questions, she would like to know if she take hormone replacement therapy. Can she take hormone replacement therapy for her menopause?
Okay. Yes, of course, you can take hormone replacement therapy. However, I advise you to see your GP and discuss the possible options. Some of the two options that I would advise are natural hormone replacement therapy as well as pharmaceutical. So you might want to discuss what suits you best with your GP and explore these options. And there are good amount of studies which are both effective in achieving the same. So yes, you can.
Thank you, Dr. Rubia. Okay. She said that she is constipated all the time. What should she do?
I would suggest to include lots and lots of fiber, lots of water, and physical activity, as it helps you move your bowels and gets the rhythmic movement that's required to push the feces out. Regular activity also helps with motility in the GI system. So I would suggest increasing your fiber intake. Often women think, or we people think that the amount of fiber that we're consuming is enough. However, it settles down and it shrinks. So having more fiber will definitely help if you're constipated regularly. Thank you.
Thank you, Dr. Rubia. Next question. She said that she is a vegan and she said she always tired all the time. What should she do?
That's an excellent question. I would say if you're vegan, that means you are not having enough of vitamin B12, and that's the reason why you're feeling tired and lethargic for most part of your day, because only animal products or animal originated products have vitamin B12 in them. So I would suggest you to try some supplements that have vitamin B12 to have a regular energy and have this as a source. Thank you for your question. I cannot hear you. Sorry, you're on mute.
Sorry, my mistake. Next question. Does tamoxifen has a long-term impact to our body?
Sorry?
Tamoxifen.
Sorry?
Does tamoxifen has a long-term impact to our body?
Non-steroidal anti-inflammatory drugs is what you're talking about? Yes. Yes, of course, it does have long-term effects over your body. That's why I shared some sustainable options that are natural, and if you consider them, it will be excellent. Of course, it does. Any pharmaceutical grade medicine does affect in long term. Thank you for your question.
Thank you. Okay, next question.
Yeah.
Okay, she would like to know what kind of food should she eat to lose weight?
Well, that's a common question that I often keep getting about losing weight. I would consider losing weight as a sustainable goal, and I would suggest you to start with smaller goals and having them achieved on day by day basis, like having healthy habits and attainable habits. Include lean protein in your diet, which is an excellent way to have enough protein in your body, have a wholesome meal, and physical activity, regular exercises, water intake, and a wholesome meal which has all groups of food will be essential to lose weight.
Thank you, Dr. Rubia.
Thank you.
Still have one more question.
Sure.
Women's bodies work fast, and how does the body gain weight despite this speed?
Women's body works fast.
Work fast, and how does the body gain weight?
How does the body gain weight?
Yes.
Okay. That's one more excellent question. You guys are rolling. So yes, why do we gain weight is a question. When we are kids, we are fine. We're eating double amount of calories, but still, these are common questions that I often keep getting. And yes, the reason being is you can blame your metabolism as well as your lifestyle habits. So as you grow, as your age progresses, your metabolism starts slowing down. That's the reason why we have to have a steady physical activity level to maintain a good metabolism level. So you all should be depending on what kind of metabolism you have and what kind of foods help you attain that. So yes, that's the reason why women tend to gain weight post menopause, because of the metabolism being slowed down, and weight is also limiting. So women often start gaining weight, which limits their joints or which limits them in different ways to go and do those normal activities that they were enjoying doing it before. So yes, thank you for the
Dr.
question.
Rubia. Another question.
Of course.
How we can avoid hypertension during pregnancy?
How we can avoid hypertension during pregnancy is the question. That's an excellent question again. And for hypertension during pregnancy, there can be 2 or 3 reasons. One, if you're overweight. Two, if you are having hypertension before your pregnancy, before you actually started conceiving. And three, we also call as something preeclampsia, which happens only during pregnancy. So these are the three reasons why you may get hypertension during pregnancy. And if you are following a diet which we call as dash diet, which has limited sodium intake, you can often keep a balance, and you also have to monitor closely with your gynec or your obstetrician during your pregnancy to avoid or have minimum side effects of this hypertension during pregnancy. And to avoid this, you should have a regular physical activity level as your body is trained to these variable hormones. So that's my answer for hypertension. Thank you.
Thank you to all of your answer, Dr. Rubia. I do
Thank
believe we already provide all of the answer to everyone. Thank you again for all of your questions. So if
Thank
you
you so
have
much for
any,
having us today.
yeah, thank you. So if you have any further question, you still can leave your question in the chat box with your email address, and we will get back to you by email shortly. So thank you again for joining us for this session.